Welcome back to your Caribou Data Science channel, Israel. Today is Monday, August the 9th, 2021, and it's time for your daily COVID-19 analysis. Before we get started here, a big shout out to the 48 people in Israel who watched this video yesterday. Thanks so much for those views. I appreciate every single one of them. Of course, before we get started, I want to just invite you to click on that subscribe button, subscribe to the Caribou Data Science channel. Of course, click on the bell. That way, you'll be notified whenever a new report, a new video is updated to the channel. Secondly, click the like button, of course. And third, most important of all, I'm going to say, click on the share button. Share this video on your Facebook and Twitter account today. You can also click on the share button, copy and paste the link into an email or a text message, and share it with your friends and family that way, okay? So let's just get on with the show here today. Now, I will remind you here that something with Washington University here in the U.S. says, they say that the single best measure of the spread of a disease is daily deaths. Okay, don't lose sight of that statement. They don't, the cases and deaths are not really a measure because not everybody who has COVID-19 gets diagnosed and not everybody who has been diagnosed with COVID-19 goes into the hospital. Okay, so don't be fooled by the news media who want to like beat us over the head with the number of cases per day. Okay. You can see, of course, there is a problem right now in Israel. Well, or is there a problem? Okay. Again, going back to that statement about cases and deaths. Well, if the purpose of a vaccine, COVID-19 vaccine, is to keep us from dying from COVID-19, but not keep us from catching COVID-19, well, that means in theory, maybe in practice thing, these numbers can go up, but deaths can remain low. Okay. And that's why it's important to keep in mind it's about deaths and not cases or hospital beds, okay? But anyway, you can't see on August the 8th you had 3,156 cases. For the 7-day period ending August the 5th, you were averaging 3,552, 3,525 cases per day on average, okay? You can come down here and you can see, it spiked up to on August the 7th, your deaths spiked up to 19, but then the next day it immediately dropped back down to 7. So what's the real daily number? Why so much volatility? If you take a look at that 7-day average for August the 5th, you can see you're averaging 9.2 deaths per day. Okay? And you can see this climb up here. Hopefully this is the peak. And this week we'll begin to see weekly cases beginning to decline again, okay? Weekly deaths, last week was the worst number of deaths since all the way back over here, okay? But hopefully, again, this was some sort of reporting anomaly. In actual fact, the numbers will resume declining back over here. But still, you only had maybe 75 deaths for the entire week, okay? Monthly cases, we can see July and August cases are going to be the highest number since all the way back over January, February, since March. July and August cases are going to be the most number of cases for any months since March of 2021. But look at deaths. Here's the spike. 1, 2, 3, 4, 5, 6, 7. Even though these July and August is showing an increase, they're still well below these 3 spikes right there. Okay. That's what I want you to keep in mind. This line here is 250 deaths. This is 125. Okay. So you're still talking less than 125 deaths for July and August. Okay, that's number again. That's an important number. Okay. But anyway, Israel, thanks so much for stopping by today. Don't forget to click that subscribe button. We're currently at 258 subscribers. Who wants to be 259? Who wants to be 260? Secondly, don't forget to click on the share button. Share this link on your Facebook and your Twitter accounts. You can also copy and paste the link to this video into an email or a text message. Again, thanks so much for your time, Israel, and thanks so much for the 48 people who viewed this video yesterday.